Most of the time when I run into Washington, 9 out of 10 comments are talking about the cost of care. And my opinion, at least, is all my time I spend on the Hill and talking to both the past and current administration is how to lower healthcare costs. I like to tell people I did not go to medical school to learn how to save people money, nor did any of my pharmacists, nurses, respiratory therapists, and the hundreds of thousands of clinicians in this country, and I think it's really important to restore health to these healthcare cost discussions. If I were to ask any of the stakeholders, thank you, what we should be spending our money on, I think or ask any of you, I think all of you would acknowledge that the most important things that we should be spending our money on are underutilized, and that we actually have to spend more. And I usually look to see where the exit is before I tell any stakeholder that we have to spend more on health care than we're spending now if we're going to achieve those goals of individual and population health. Because my career has not been based on cost of care, but it's the underutilization of things that I beg my patients to do, whether it be prevention, diagnostic tests, chronic care of diseases, or end-of-life care. As we look at the things that we should be doing for which the evidence is strong, whether it come from clinical trials or real-world evidence, there is substantial underutilization of those things. I mean, the biggest myth in Washington is that people believe that the improvement of high-quality healthcare actually will lower healthcare costs. They hardly ever do. That has been my holy grail, but it shouldn't lower healthcare costs. Living longer, better lives is something we should invest in. We have to change the healthcare conversation from how much we spend to how well we spend it. I've been quite outspoken that if I were designing the American healthcare system from the bottom up, I wouldn't be kind of apologetic for 16% of the spend going to pharmaceuticals. I think it would probably be about 25%, given the data we have on safety and efficacy.